Hi guys, so another travel related video today. I recently asked if anybody had any travel questions about Rwanda, and one of my viewers, London Made Easy, was asking about Mpox and whether or not it was something to be concerned about because they're planning to take a trip there soon. So I probably don't have to explain what Mpox is. It was formerly called monkeypox, and it's like a very virulent form of chicken pox or smallpox kind of related disease where you get bumps and they turn into blisters. Very uncomfortable, and also can be life threatening if the blisters get infected, or I think if they get into your lungs and places that they really shouldn't be. So it's a really unpleasant disease to catch, and unfortunately there is now a more virulent strain of it that is more easily spread. And to date, it appears as of sort of mid-August of 2024 that around 14,000 cases have been detected in this latest outbreak or have been confirmed, and almost 500 deaths. From what I've been seeing, I haven't been seeing that many updated articles and statistics from this week. So it's currently the 26th of August at the moment. And most of the statistics I'm seeing are from about a week or two ago. And earlier on in August, 4 cases of Mpox had been detected. But looking at the WHO map, or the World Health Organization map, for the 22nd of August, so about a week or so ago, it's not showing Rwanda as being a hotspot for Mpox at the moment. Now, I'm not currently in Rwanda at the moment, so I'm in the UK visiting family, and sometimes you don't always hear everything that's going on once you're outside of the country. So I'm only really speaking about it as an outsider, but as someone who lives in Rwanda and has lived there for a long time and will be going back there in a couple of weeks. And these are my thoughts on the situation and whether or not you should be worried. Of course, always keep your eye on the news and look at especially the UK government news or your home government's news about travel advice for whichever region you're going to. Keep an eye on the WHO website and their latest updates. I'll leave that link below. And also, if I hear of any big updates or something changes in the next few weeks before I fly, I will definitely leave an update in the comments below. So the first part of that question, am I worried? At the moment, no, because 4 cases out of a population of about 14.5 million people is nothing at the moment. So at the moment, the spread of it doesn't worry me. Now, I know a lot of people might say, but are you getting the true statistics? And there is often a lot of skepticism, especially from Western countries towards African countries, about whether or not they are reporting infection rates properly. Are people being tested? And if they're found to be infectious, has that been recorded, and is that being publicly reported transparently? Now, there is some precedent as to why people are a bit uncertain about that kind of thing, because to be fair, during COVID, I'm not going to name the countries because everybody living in the region knows who they were. But during the COVID outbreak, there were 2 countries in East Africa where the presidents, the leaders of those countries said, "Oh, we are the land of God. We are protected from COVID. COVID isn't in our country. It will never come to our country. We're totally protected by God." And both of those presidents then died of COVID. So, yeah, there is sometimes a bit of suspicion around whether or not things are actually being reported correctly. Rwanda is not one of those countries. Speaking as somebody who spent the entirety of COVID in lockdown in Kigali, I got to see firsthand how Rwanda copes with a pandemic and a major national health emergency, and they did really well. What a lot of people don't realise about Rwanda is before COVID happened, we were all preparing for a pandemic anyway, because Ebola was steadily creeping closer to the border with Rwanda. So in northern Rwanda, you've got a city called Gisenyi, and 4 miles to the west, so just over the border, within walking distance, you've got Goma. And Goma is a massive trading point. It's a huge point of business for many Rwandans as well. And people cross over every day and cross back from work. And Goma attracts people from all over the Eastern Democratic region, Democratic of Congo region, to trade in Goma. And unfortunately, Ebola outbreaks get spread, when people are traveling. So you've got people from Ebola regions traveling to Goma, and you've got Goma just over the border from Rwanda, and lots of people going over and coming back every day. So we were sitting there watching Ebola getting closer to Goma. It eventually reached Goma. And I think everybody was sitting there going, oh, great, yep, the next pandemic's going to be Ebola. Ebola never made it into Rwanda. I don't think it's ever made it into Rwanda. But then COVID happened. But when COVID happened, we already had all of the isolation wards. Everybody was on high alert. There were washing hand stations, kind of getting geared up and ready to go. So it wasn't really a total surprise that there was a health emergency. It was just not the emergency everybody thought it was about to be. So because of that, Rwanda already had a very solid public emergency health response plan in place, and basically just changed the name of the disease and off they went. So they handled COVID really, really well. I got 2 doses of Pfizer really early on. I got my 3rd when I came back to the UK. It was all managed very well. From my perspective, if you were living a different experience, then tell me about it below. From my experience, it was good. And so the statistical side of things was also being recorded and managed by Rwanda Biomedical Centre. And every day you could log in and watch, the new reported cases going up. There was a tally of infected cases, a tally of deaths, and it was split by male and female and around the region. So you could really break down the statistics and see what was going on. I felt that the reporting was extremely transparent during that point. I don't feel that there was ever any cases of people trying to cover over the number and telling people that, it wasn't happening, or, it was very well managed, and I felt informed and calm throughout the entire process. So I feel that if monkeypox does become a bigger issue in Rwanda, that, firstly, I think that the medical facilities are fairly well prepared. And secondly, I think that you will get accurate information ahead of travel or once you're in the country if there is anything that needs to be said. But at the moment, I'm feeling like it's probably not a huge deal right now because, like I said, 4 cases appear to have been reported. And I feel like if there were hundreds of cases being reported every day, we would know about that. That would be in the news. There'd be health advice issued. There'd be something on Rwanda Biomedical website that would tell you what was going on. At the moment, they've linked to one tweet, and the tweet is only in Kinyarwanda. So people are asking for it in English as well, but I feel like if it was a major public emergency, you would be getting that messaging in all of the languages or the official languages of Rwanda, which are Kinyarwanda, French, English, and Swahili. At the moment, it seems fairly low key. A question I've been getting a lot from family is whether or not I'm going to get vaccinated before I go home. I did look into it. I did email around because there was an Mpox outbreak. I think there were cases in the UK a few years ago. But when I looked into it, local travel clinics in the UK were saying, no, we don't stock it. The only places they said that you could get an Mpox vaccination was at a sexual health clinic in London. And I was thinking, well, I'm not going to go all the way to London to get it. And the other thing that I wasn't sure about was whether or not the vaccine is for the most recent strain of it, the virulent strain of it, or whether or not it's for the strain of Mpox that we had in the UK a long time back, and whether or not those 2 vaccines do the same thing or not. It also appears that you have to have them a few weeks apart. So there are 2 doses and you have one and then you wait and you have another. That isn't practical for me at the moment because I don't have that much longer left before I fly. So as with COVID and as with malaria, I tend to assume that I am more likely to get the correct vaccination, the correct medication in the region that is most affected. So if it does turn into a significant outbreak in Rwanda, it's probably more likely that I will get an effective vaccine in Rwanda than I will trying to get it from the UK, which is pretty much not affected at the moment. So I'm not too worried about that. As I saw with the COVID vaccine, it was rolled out really quickly in Rwanda, very effectively administered. So I'm not worried about not having access to the correct medication if it becomes required. Now, there was actually one other small little outbreak that I should probably mention. Back in January, February of this year, there was actually a conjunctivitis outbreak, so a pink eye outbreak across East Africa. And it was severe enough that it actually made the news and there was public health advice being given out. So at the time, I was working on The Forest, which is sort of a horror show in Rwanda, and one of our cast members came in and he'd actually contracted pink eye. Um, and it was spread by, physical contact. So he continued with his work, but he just wasn't allowed to sort of touch or interact or, get too close to anybody. And I think that's really down to the advice that you should always follow if there is an outbreak of anything going on is, don't go around hugging people. Try and minimize your physical contact with people. And this might sound like a silly thing to say, but actually, pretty much across the whole of Africa, that is easier said than done. Because as a British person, when I am in England, I wave and smile at people that I know. It's very, very rare, except maybe in a very formal business situation, that I'm ever going to shake somebody's hand. But in Rwanda and across Africa, you always, always greet somebody with a handshake, with a handhold. Sometimes you might touch foreheads with somebody. In Francophone regions, you might be kissing people on cheeks. It's very, very common to bump shoulders. There's a lot of hand holding going on. And even during the COVID outbreak, it was really difficult because it just didn't feel right not to touch somebody at all. So people started bumping elbows instead and touching feet. It was a very interesting psychological experiment, to be honest. But yeah, that's something to be aware of if you're coming from a Western country or Western culture. Be aware that it's okay not to engage physically, because it can be quite difficult because you don't want to offend anybody, and especially you're traveling, you're a long way from home. When in Rome, if somebody hands you their hand, you feel like you have to take it, and go along with what's expected of you. But it is okay just to say, oh, you just do the awkward Western thing of just you know or off your elbow instead. Um, that's okay. And also, I would suggest just avoid crowded places. So, public transport is also one to watch. If you're traveling long distance around the country, most buses now are fairly modern and you get your own seat. So, there's a little bit of space between you and the person you're sitting next to. But certainly in more rural areas where they're still using the little tin can bissies, you're going to be cramped in with people. You're going to be like three or four to a seat. So just consider how you're going to get around the country, and maybe plan for having a bit of breathing space, um and not getting into really crowded situations. Also, if this does become another pandemic of note, then I'm sure that the hand washing facilities will be back out again very quickly. During COVID, there were washing stations outside shops, in restaurants. When you went into buildings, there was alcoholic hand rub. That's another good thing to take with you. Make sure things are clean. If you're staying in hotels, check the room, make sure it looks properly cleaned before you stay. Check, the sheets and things look fresh. Yeah, just take all the normal precautions you would take back home. So, of course, I'm looking at this from the perspective of somebody who lives in Rwanda and who is going to be there throughout the duration of any outbreak. But of course, if I was, say, a tourist, or if I was traveling with my family, there is something about it that might concern me, and that would be if there was a sudden escalation, whether or not the airports would be closed down. Because we saw that with COVID, is there was a point at which every expat had to make a very real decision about whether or not they were going to stay or whether or not they were going to attempt to get home to their country of origin or nationality. And of course, there's a cutoff point for that, beyond which you cannot change your mind. So that's the only thing that would be on my mind, is if there was a sudden escalation and the airports were closed and non-infected countries refused to accept people traveling from infected countries. However, again, from my experience with COVID, even though that escalated very quickly, you still had a warning and you still had time to get to the airport and to go. So I don't think you're ever going to be in a situation where all of a sudden all of the borders are closed, all of the flights are grounded, and you were never told it was about to happen. I'm sure that you will have enough time to get there. And Rwanda as well, it's a small country. You know, I don't think there's anywhere in Rwanda that you could possibly go to visit where you couldn't get to the airport within an absolute maximum of about maybe 10, 15 hours if you're in the very, very far south, maybe Changugu. But most places are no more than about 4 or 5 hours away. So, you know, you're always going to have that opportunity. And I think if things start to escalate and it becomes more of a concern, I think you're going to hear about that pretty quickly. So that's my advice. For the time being, I'm not worried about it. I think that the cases, or the confirmed cases in Rwanda, are so low at the moment, and you know, we have very good containment facilities and testing facilities, especially on the borders where people are crossing. I think we're probably good for now, and if that changes, I'm sure you'll hear about it. So check out some of the links that I've left below. If you've got any other opinions or you know anything that I don't know, let me know below.